From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast. Since we launched this show, we've spoken a lot about the internal and external factors that can influence a practice's efficiency. We've also covered the solutions healthcare providers can implement to improve productivity, profitability, patient satisfaction, and retention. Today, we're diving into scaling that productivity and maintaining it long-term. Our guest has 13 years of experience doing just that, and I'm excited to introduce you all to VP of Business Operations here at Rectangle Health, Sandie Ryan. Sandie, thanks for taking the time to join me. Excited to have you on.
Hi, Gary. Thanks for having me. I'm really excited to be here today.
My pleasure. So diving right in, 13 years focused on developing well-oiled machines that are operating at high efficiency. How many years of that experience is specifically in healthcare, and did that begin at Rectangle Health?
So, Gary, I've been in operations for 13 years. I started in the customer care space back in, maybe 10 years or so ago. And at that time, I had a real passion for the customer experience. It was really important for me to identify what customers' concerns were. What could I do to help make their lives a lot easier? Over the years, I somehow made my way over to the healthcare space, and I've been at Rectangle Health now for 7 years. I'm really excited to be here, and I'm seeing a lot of growth in the healthcare space, and I'm always looking for ways to help those practices become more efficient.
Awesome, Sandie, and thank you for that background. So getting right into it, what are some of the exploration questions a practice can ask themselves to, let's say, identify roadblocks in productivity?
Well, today, obviously, the roadblocks are so different than they were pre-COVID. But one thing that I think is really important is I read a study just recently and found that 94% of physicians find it even more difficult to support financially and administratively an operation or practice in today's world. So some of the questions that we kind of, hear in the healthcare space today around identifying some of these roadblocks are, how many systems are they working out of? That's sometimes can be a major pain point. Does their staff need more training? What kind of things their staff feels are mundane tasks that they do every day are repetitive and maybe can be done a little bit more efficiently? What kind of automation would be helpful? What could they do that would, just kind of make their day a little bit smoother? Turnover definitely helps provide some gaps within that organization and identifying those. And really just asking the front line what kind of roadblocks they're running into just in operating on a day-to-day basis.
So once those roadblocks are identified, either in exploration or discovery phase by the practice or by your team, what's the next step to help increase that productivity and break through some of those roadblocks?
Well, whenever you look at identifying roadblocks in productivity, one of the first thoughts that come to my mind, especially in the space that I'm in today, is what can I consolidate, right? There's so many different applications out there today, or there's so many different tools. It's not always a one size fits all. And I think one thing that's really imperative in this space is really identifying what those barriers are and finding a tool that you can help, kind of simplify things with, right? Consolidate. So replacing those mundane tasks that those practice managers or the office managers run into on a regular basis. Finding someone at that practice that can deal with an organization that can help guide them through that process. Those are some of the ways to kind of break down those barriers and figure out how to help that staff become more productive.
It's really interesting. And so what's the feedback from the dentists, from the doctors, the office managers, learning that there is a tool that solves these problems? Are they seeing immediate results? Does it take time? How does that look?
So, every practice is different in how they use tools that they put in place. It really is identifying those roadblocks and being able to tie them down to direct solutions that are going to help solve that problem. One of the things that I find really interesting in today's world is that you have people that are holding multiple hats, right? They're processing payments and they're they're filing insurance payments, and they're doing scheduling, and maybe even helping a patient find a financing option if they can't pay a bill. So the feedback from doctors and office managers has been really positive, because with a tool like ours, it's a one-stop shop, right? They can find everything to solve that practice's problem in today's world, and they see immediate results. Some of the practices find that there's some tools that work better than others. Some may find that putting a card on file is a practice that they want to do regularly, whereas other practices may want to do it only from time to time. So the feedback's really positive, and I think what's really important is tying it down to exactly what their use case is.
Makes sense. And I want to shift gears here for one quick moment, and it'll all come together. But how closely is your team aligned with and in contact with, Rectangle Health's developers, the people building and enhancing practice management bridge?
So Gary, like I said earlier, I've been at Rectangle Health for 7 years. And one of the things that stands out with this organization that's very different from any other is the collaborativeness between the teams. We are in constant communication, and the front line at Rectangle Health, our customer service department, which is by far probably one of the best in the industry, as well as our customer success team, are in constant communication with product and developers.
How quickly is your team reaching out to telepractice? Hey, there's this new feature that will help save you time or money. And for example, and hopefully our listeners don't have this many patients with outstanding payments, but sending mass texts to everyone who owes, or managing compliance requirements, or automatically sending appointment reminders and filling open slots in the schedule.
So new features are available every day in the Rectangle Health space, and how our customers use them is evolving every day, right? Based on what the needs of their business are or what their staff prefers. What my team tries to do is for every new customer is making sure that they understand all the tools that are available to them right out the gate. Today, when you sign up with Rectangle Health, you may only see a use case for putting cards on file, whereas tomorrow you may want to be sending out web payment links. We serve up that information to customers as they need, and we try to make sure that they're aware of everything that's within the tool on day one. We try to provide content to customers when they see fit. So if they prefer for us to give them a call and walk them through a training, or at the time when they sign up, we may share all the tools that are available to them, and they may want to implement something only on day one. We provide them with the contact information should they have a need for additional training down the line. Or let's just say an office manager changes or leaves the practice. Our customer service line can schedule a training or a quick walkthrough at any time for that customer. So the information is readily available. We try to push it out when it's important, when it's meaningful to the customer, but we also are here whenever they need us.
The reason why I asked about alignment specifically between your team, and the development team at Rectangle Health, and then going back to the practices, the OMs, all of them, is because patient expectations have changed and are constantly changing. Then there are factors like COVID, which significantly changed the way healthcare business is run, then staffing shortages and employee retention. Now, I'm not a healthcare provider, but I've onboarded technology everywhere I've been throughout my career. And I've always stuck with the solutions that evolved with the times, and really have the best support and those open lines of communication, because it's allowed me to be as productive as possible. And it's no different here in this case.
Absolutely, Gary. Staff needs to be enabled to achieve greater success and productivity, and that's exactly what we're trying to do. We're adopting a human partner through the relationship. We are providing our customers with direct access to those tools that they need just to solve their day-to-day problems. One of the things that I find really important, especially as solutions evolve over time, is I may sometimes want to reach out and get more information. Other times I may want information pushed out to me. And that's what we try to do here at Rectangle Health. We try to find a good balance so that we're not interrupting our practices day to day, but we're always here to help them get to that next level. We're here to help them figure out and navigate through some of the challenges that they run into every day as a business owner or a practice manager. So the staff at Rectangle Health, what we try to pride ourselves in is the fact that we have those tools all available to us. We can answer those questions when you make a simple call into our customer service department, or we can call you at any time and provide you with enhanced training. So when you look at a solution in this space today, there's so many things that are available to you. But the one difference between Rectangle Health is that we have an incredible tech stack. We provide many solutions for those practices all in one solution. And today, with all the different challenges that these healthcare practices are up against, we want to make it simple. We don't want to overcomplicate it. We want to consolidate it. And we also want to provide that human touch. We're here. We're here to support you. We're here to help you grow. Here to help you navigate through the challenges that your practices run into every day.
That's amazing, Sandie, and thank you for that. And last question before we wrap up here. What's your best advice to a practice from a business perspective?
I mean, I think the best advice that I can give is just ask your people how you can help. Just ask your team how you can support them better. Ask them how their day can be easier, because in today's world, we're all faced with so many challenges. And I think one of the things that's really imperative is just identifying how we can help solve some of those challenges. And I find just talking to my staff and asking them, what do you run into on a day-to-day basis? What's troublesome for you? How can I make your life easier? I think that's the one advice I can give, is just talking to the front line, asking them what they need and helping them find the solutions that best fit their needs as well as your needs as a business owner.
That's brilliant. I love that, Sandie. And I know you're busy, but selfishly, I have to say it here, I'd love to have you back on the show again real soon to talk more about this. Thank you so much for taking the time.
Thanks so much for having me today, Gary. Have a great day.
My pleasure. For our listeners tuning in, as always, we want your feedback. Let us know how we're doing and what topics you'd like to hear covered on future episodes. And before we wrap up, I also want to note in the episode description, I'm going to include a link to a no-cost assessment. It's 100% free that will show you how effective a solution like Practice Management Bridge from Rectangle Health can be for your practice. Plus, when you sign up, you get Sandie and her full team supporting you and your staff. It's the power of the platform and the people behind it. It's game-changing. Thanks for tuning in. Till next time, everyone.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.